Consultants with Voices for Healthy Kids, which supports the National Collaborative for Infants and Toddlers. And we are so excited to have you and to be continuing our series on paid family medical leave. Our first session was Paid Family Medical Leave 101 focused webinar. In case you missed it, we're going to be adding a link to that in the chat box. So today's session is focused on existing state policy landscape. So we've got 13 states plus Washington, D.C. that have enacted paid family medical leave programs. And benefits are available to families in 10 of those states, and benefits soon will become available to the remaining 4 states in 2026. However, no 2 states are the same. Today, we're going to provide a deep dive of this landscape. We'll be covering how states vary on critical policy components, including eligibility, duration of leave, wage replacement benefits, funding mechanisms. But first, next slide, wanted to do some housekeeping before we get started. So today's call is being recorded, and we will be sure to share that recording and the slides within a week. And we ask that you keep yourself on mute while you aren't speaking. And if you have any questions, just know that we're going to have a Q&A session at the end. So you can enter your questions into the chat during the presentation, so you don't forget, or just during the Q&A session, you can raise your hand and take yourself off mute. Closed captioning is available through settings on Zoom, and we're always happy to provide translation services. Just let us know when you register in advance for any upcoming webinars or events, and we'll be sure to make that happen. And if you need any assistance during the call, please send a direct message to tech support, and they will do their best to help. And now let's get started. Next slide. So I have the honor of introducing our 2 speakers for today's session. Today, we're going to learn from Sarah Ritter. Sarah is a Senior State Policy Analyst at the Prenatal-to-3 Policy Impact Center at Vanderbilt University. In her role, Sarah monitors the development, adoption, and implementation of state policies related to economic security for families with young children. She analyzes policy variation and trends across the states and serves as a resource for state-level policymakers and advocates. Sarah also contributes to the development of the annual Prenatal-to-3 State Policy Roadmap. Sarah has extensive experience in community engagement, coalition building, and policy research and analysis. She holds a master's in social work from Washington University in St. Louis and currently lives in St. Louis with her husband and 2 cats. Welcome, Sarah. Next slide. We will also be hearing from Jared Make. Jared Make serves as Vice President at A Better Balance, where he works alongside advocates and coalitions around the country to write, pass, and implement laws guaranteeing paid sick time and paid family medical leave. With his colleagues at A Better Balance, Jared has helped to draft laws that provide paid sick time to more than 60 million Americans. He's championed the adoption and implementation of paid family medical leave programs in 13 states and Washington, D.C., including the groundbreaking passage of Colorado's Family Ballot Initiative in 2020. He also co-founded ABB's LGBTQ Rights and Family Recognition Project to protect the rights of LGBTQ workers, raise awareness about the diversity of family structures, and enact workplace policies that cover a range of caregiving relationships. His work has been featured in many news outlets, from the Denver Post to the New York Times. Welcome, Jared. Next slide. And now we're going to have Sarah kick it off.
Great, thanks, Raquel. Share my screen. You all go. All right, so welcome everybody. As Raquel said, I'm Sarah Ritter. I'm the Senior State Policy Analyst at the Prenatal-to-3 Policy Impact Center at Vanderbilt University. So here at the Policy Impact Center, we are a nonpartisan research center. We aim to educate lawmakers, state agencies, advocates, and academics about policies that we know will help families thrive. So the center identified by using the research on the developing child what conditions in which children need to thrive. So these conditions were used and turned into our 8 policy goals. So we evaluate state policies against these policy goals, and so far have identified 12 effective policies and strategies, which you can see listed here, that achieve these policy goals. So paid family and medical leave is one of those policies. The grid here is hard to see on a slide, I know, but it shows how each of the 12 policies and strategies aligns with our 8 policy goals, which are up top, based on the most rigorous causal research that's available to date. So here I'll zoom in on that paid family and medical leave part of the grid. And what I really want to highlight here is just how impactful a paid family and medical leave policy is for families with young children. We see positive impacts in 7 of the 8 policy goals. And even more, we know that paid family and medical leave has a range of impacts. We see positive impacts to the labor force, to mental health for mothers. It leads to reductions in food insecurities for the family and lower rates of infant mortality. So the benefits of paid family and medical leave are far-reaching. However, despite what I'm sure all of you already know, and I don't need to tell you that paid family and medical leave is really important, we also know that too many people don't have access to paid leave, which is kind of where we're going to get into today. And this is like the bread and butter of what we're going to talk about today. So because there's no guaranteed paid leave on the federal level, states have stepped in. So to date, as Raquel mentioned, 10 states, that includes the District of Columbia, have implemented paid family and medical leave programs. And by that, I mean that the benefits are currently available to families. Families are able to take paid leave. And there are 4 states that have adopted programs, are currently in the process of implementation, but that will be fully implemented in the future years. So California was the first state to implement a statewide paid family and medical leave program in 2004, over 20 years ago now. So one thing I really want to note here when we're thinking about the timeline is that those earliest states, your California, New Jersey, Rhode Island, and New York, those first states to adopt a program, they actually did so by amending existing temporary disability insurance programs. These provided paid medical leave only. So they amended those programs to then include paid family leave access. So Washington was really the first state to build a brand new paid family and medical leave program. And another kind of interesting fun tidbit is Colorado is the only state so far to adopt a policy through the ballot measure process. So you'll see those 4 additional states. There is a chance, I'll just add a little note in. There's a chance that Maryland will extend their implementation to 2028. We'll see what happens with that. But as of right now, it is set to be implemented in 2026. All right, so now let's get into how states vary, since that's what we're really going to talk about here today. So we like to say, if you've seen one state's paid family medical leave program, you have seen one state's paid family and medical leave program. So as you're considering a program in your state, I think it's important to understand the types of decisions that you'll need to make, as well as sort of the range that exists within those policy levers. So while no 2 programs look exactly alike, these programs do all have similar components to them, though. It's just the details, the nitty-gritty details within each component varies across the states. So I'm going to cover a few of the key policy components today, but not all of them. Jared will touch on a few more of the critical policy components during his presentation, such as thinking about definitions for family, what a family member means, which can impact who you can take leave in order to provide care for. But we're not going to cover every single thing today. So if there's more information and you kind of want to dig in a little bit deeper, we have a couple of resources that I'll talk about at the end where you can get a little bit more information. So also, before I really get into the details here, I just want to mention that all of these decisions that you're going to make have implications for equity. So I always encourage states to think about what their goals are for a paid family and medical leave program and have those goals help guide you in your decision making around these policy components. So when you're in the weeds on a certain policy component, you're able to like kind of step back and say, what was our goal here? And have that be what drives the decisions that you make within the nitty-gritty. All right, with that, let's go ahead and get started. So the first decision that states make, and the policy component that I feel like we talk about the most is that duration of leave. So how long can a parent or a worker take family and medical leave for? So talking about family leave first, so this includes your bonding leave or parental leave, time off to care and bond with a new child following the birth, adoption, or placement of a child into your home through foster care. This also includes caregiving leave, which is that time away from work where you can care for a family member that has a serious medical condition. Both of those things are encompassed within family leave. So most states are providing at least 12 weeks of leave, as you can see. From the most rigorous causal research that's available, we know that in order to realize those outcomes, those positive outcomes that I mentioned earlier, these programs have to provide at least 12 weeks for parents who give birth and at least 6 weeks for all other parents. Since most states don't make that distinction, really, we're talking about 12 weeks here. So states have increased their duration of leave over the years, including Rhode Island, who enacted a bill last year to increase their leave from 6 weeks to 7 weeks starting this year, and then will increase to 8 weeks in 2026. So you'll see here when we're talking about the variation within paid medical leave, there is more variation in the maximum number of weeks provided for medical leave than there is for family leave. So kind of recall those states that had existing temporary disability insurance programs. Four of the five of those states that offer more than 12 weeks of leave are states that had existing temporary disability insurance programs. But these are maximums. So this is the maximum number of weeks that you would be allowed to take following a serious medical condition. These are not always the duration that a worker with a serious illness would be approved for, nor that they would actually take. So for example, in my world, thinking about people with people with new children in their homes, recovery from childbirth is a qualifying reason for medical leave. But a person who has a very uncomplicated, so to speak, birth would qualify for 6 to 8 weeks of medical leave, depending upon the type of birth. So I mention this because in some states, parents who give birth can take medical leave followed by family leave in order to receive a longer duration of leave. This depends on the state's cumulative maximum, which is the total number of weeks that of any type of leave that a person can take during a benefit year. So I apologize, I don't have a slide here with those cumulative maximums, but we do have a great table that's in our 2024 state policy roadmap, which we can link to in the chat for you all, where you can see the maximum durations for each type of leave, as well as the cumulative maximum, and then see kind of like what that would mean for a parent who gives birth. So prenatal leave. What I mean when I talk about prenatal leave here is it's leave that's designated leave for the prenatal period, separate from medical leave, and it's provided in addition to family leave. So there are several states that specifically provide leave for that prenatal period. DC's program provides 2 weeks of prenatal leave, and they very specifically market it for prenatal care. It's to help you be able to attend those routine medical visits. I'd be remiss if I didn't mention that medical leave, though, can also be used intermittently to attend routine doctor's visits, and states that have paid sick days, that time can also be used for this purpose. A lot of folks have probably heard, but New York began providing an additional 20 hours of paid sick leave, specifically that has to be used for prenatal care. That began in January of this year, which is really exciting to see. All right, that next policy component is another really big one that gets talked about a lot. And this is the decision about your wage replacement system. So this is what portion of a worker's average wages they're going to be able to receive while taking paid leave. So there are two generally different approaches to this. The first is a single flat rate wage replacement rate. So there are 4 states that use a single flat rate wage replacement system, and this basically means that it's the same rate for everyone. Everyone receives, regardless of income, receives some portion, a percentage, like 80% or something of their wages up to the maximum benefit. And then there are multi-rate wage replacement systems. So the majority of states use this type of system. 10 states do. So sometimes you'll hear this called a progressive wage replacement system or a graduated wage replacement system. But basically what this means is that there are multiple wage replacement rates that are applied to different portions of your earnings, again, up to a maximum weekly benefit. So people with lower incomes typically receive a higher percentage of their wages while on leave than those with higher earnings. You can think about this if it's helpful, not always helpful, but it works very similarly to the way that our federal tax systems work. So states do take different approaches to determining exactly what those multi-rate systems look like. So just a shout out that if you're interested in getting into the weeds on wage replacement rates, send me an email. Our team would be more than happy to walk you through the nuance, and we would show you math charts. It would be great. We would love to do it. But as I mentioned before, most programs are using these multi-rate wage replacement systems, and the most recent states to adopt programs have all used multi-rate or progressive or graduated wage replacement systems. Similar to our duration of leave, states have also increased wage replacement rates over time, including California, that just increased their wage replacement rate this year. The new wage went into effect this year. So for comparison, here are the wage replacement rates for parents earning lower incomes across the state. You can see here that the marginal or those multi-rate systems tend to be more generous, especially for lower income families. So another component that is related to that what a person would receive while they're taking leave is the maximum weekly benefit. So it is what it sounds like. It's the maximum amount that a person can receive each week. So you can kind of see how they range. In all states except New York, the maximum weekly benefit is the same for family leave as it is for medical leave. New York's maximum benefit for medical leave is significantly lower than it is for family leave. And states typically decide what these maximum benefits are going to be based on whatever some percentage of their state's average weekly wage. And so these change every year. So there's a couple of things I think I want to mention just to sum up this wage replacement rate, I think, and some key takeaways here is that first wage replacement rate really determines the program generosity for parents and people who have lower earnings. Whereas that maximum benefit can determine how the program's generosity for your middle or high earners. But these things really work together. And like I mentioned before, the multi-rate or progressive wage replacement systems, they tend to be more generous for a larger proportion of parents than our single flat rate systems do. That doesn't have to be universally true because a number of factors impact that actual benefit amount. But in our current state, the states with current programs, that's true. Another really important policy component is like who is covered under the program, and what, if any, requirements do those covered workers have to meet before being able to take leave. So a lot of states with existing programs automatically cover, almost all employees. This means, and what I mean by automatically is this means that employees don't have to opt in. Just by the nature of meeting the eligibility criteria, they can, they've been paying into the program, they can apply for the program, they can apply for leave when they need it and receive the benefit when they need to. On the flip side, typically self-employed workers have to opt into the program. So they have to go in and say, yes, I want to pay into this program, and yes, I want to be able to receive benefits. that they're the employer and the employee, so that's kind of why that works that way. And in all states except for New Jersey and Rhode Island, self-employed workers are allowed to opt into the program. But once a worker is covered under the program, there can be additional requirements that they must meet in order to qualify to actually take leave. So these are either tenure or like work hours worked requirements or minimum earnings requirements. So New Jersey has both an hours worked requirement and an earnings requirement. That's why the number adds up to 15. But you'll see that in all of the 9 states, so all of the 9 states with an earnings requirement, which means that workers must have earned a certain amount over a certain period of time before they can qualify for leave. All of those 9 states allow a worker to combine their earnings across multiple employers. This is a really critical component because a lot of people work multiple jobs. So this allows them to actually receive to use all of the jobs and all of the earnings that they've received in order to qualify for wages, and then often also to calculate what their actual benefit would be. So another policy lever and component is whether or not a worker will have their job protected for them while taking leave. So job protections require that the worker be placed in the same position or a comparable position when they return from leave. Some states require a worker to be employed at their current employer for a certain period of time before that leave would be considered job protected leave. This ranges from 90 days to 12 months of employment. So job protections are really important. I think ensuring that you can come back, a worker can come back to their job. They know that their job will be available for them after taking leave is such an important protection to make sure that eligible workers actually take the leave when they need to take the leave. One thing that we know is that paid family medical leave doesn't make people have babies. People have babies. And when they have those children, when they have a need for paid family, have a serious medical condition, and they have the need for paid family medical leave, if we don't allow them to take the leave, then we don't realize those outcomes, those positive outcomes that I mentioned earlier. So we have to create a way that people actually feel like they can, in fact, access the leave. And I think providing job protections is one of those ways. So somewhat of an aside here too, but this often comes up kind of within this conversation, is there are also ways that states support employers while their employees are taking leave. So for example, Washington provides grants for small businesses to help cover the costs of employees being gone. This can include hiring temporary workers if that's necessary, although we know most employers actually don't hire temporary workers. So just kind of a plug that that is an option. All right, so finally, how do states fund their programs? I think typically the million-dollar question. I like to remind folks here that paid family and medical leave is an insurance program. So the state does not provide ongoing general revenue for these programs. Instead, like other insurance programs, paid family and medical leave is funded through payroll contributions, which are also referred to as premiums, that are paid for by workers and or employers. So the table here details who pays for the program. The states are listed in order of policy adoption. So you can see that the most recently adopted states split the costs of the program, share the cost of the program between both workers and employers. And another decision is in those states that share the premium. They have a decision point around the degree to which they split the premium. So I'll show you this chart of the premium rates from 2024. So this is what was in existence last year. But you can see the overall rate in each state, as well as what the specific worker and employer premium was. So again, these are listed in the order of adoption. So you can see that, one, you can see the majority of states, as you could see before, do share the premium between workers and employers to some degree. But the five most recent states in particular, evenly 50-50 split the premium between workers and employers. DC is the only state where employers cover the full cost. And that's for very specific to DC reasons. All right, so I wanted to show you all, lastly, kind of show you how all of these policy decisions come together to provide paid leave benefits. So this chart shows the projected benefits for a parent taking leave following the birth of a child in 2024. So this is from last year. It does not include Rhode Island's increased duration. That's not reflected here. But what you'll see is the lighter blue shows what the estimated weekly benefit would be, while the darker blue shows what the total benefit over the full duration of leave would be in these states. We projected benefits for those 4 states that haven't started implementing their programs yet. I'll also note, in case folks are wondering, Massachusetts does provide 12 weeks of leave, but there is a 7-day unpaid waiting period. So that's why this shows only 11 weeks in total of paid leave. Great. So as I mentioned in the beginning, I certainly did not cover every policy lever or component that goes into drafting a comprehensive statewide paid family and medical leave program. Jared's going to touch on a few more, but I did want to highlight a couple of our resources that might be helpful to you all as you dive in more into the weeds. So one of them is our state policy checklist. This checklist provides a list of kind of the key components, some of those that I talked about today, but also others, of a paid family and medical leave program. And the second is our paid family and medical leave profile that's on our 2024 state policy roadmap. This provides more information on the research on the impacts of paid family and medical leave, progress that states have made in the last year to adopt paid family and medical leave, as well as how states' existing programs vary. So some of what I've talked about today. We do update our roadmap annually. It was last updated in October of 2024. So with that, I will stop sharing my screen and I'll pass it over to Jared to continue the conversation today.
Hey, everybody. So nice to be here, and thanks to our partners for having us. So I'm Jared Make, he, him pronouns, Vice President of A Better Balance. A little bit about us, if you're not familiar, although I know a lot of you have worked with us before. We're a national legal advocacy organization. We have offices in New York, Tennessee, and staff throughout the South, Colorado, and DC. And you can see our mission here, really ensuring that workers can care for themselves and their loved ones without sacrificing or risking their financial security, and some of the issues that we work on, including paid family and medical leave. And should mention, we go deep on the ground where we're based. I'm based in Colorado, so as you heard earlier, Colorado is the only state that's passed paid family and medical leave on the ballot, and I was fortunate to work on that for many years, and the drafting of the ballot initiative and implementation and enforcement. And we also work leading the campaign in New York, as I mentioned in the chat, around reforming paid medical leave, and then we're working throughout the South on the ground on these issues as well. But we also provide technical assistance and legal support to coalitions in the vast majority of states at this point. We co-wrote the model legislation that's been used in all the programs that you just heard about. And we also work on implementation and enforcement. You can see in the top right on this slide, we have a 1-800 number that's for our free legal helpline. And we provide legal support on these issues to workers throughout the country. So, just to build on the presentation that you just heard, we also have a fact sheet here, and I believe these slides will be circulated afterwards, that walks through in a 2-pager kind of the key components that you just heard about. We also have a less public facing, because it's so in depth, but a very detailed guide to core issues and considerations for paid family and medical leave. And folks can definitely reach out if you'd be interested in receiving that. So, just wanted to build a little bit on what Sarah just shared about some of the covered purposes of the statewide programs. All of them cover, at least as you see here, a worker's own serious health needs, bonding with a new child, or caring for a seriously ill loved one. Most also allow caregiving leave related to military deployment and caring for loved ones when a family member is deployed. And 6 states provide safe leave for domestic violence, sexual assault, and/or stalking, depending on the law. We see the majority of states, when we talk about bonding with a new child, covering birth, adoption, or foster care placements, and certainly advocate for that to be inclusive. Some states are now considering bereavement leave, so did want to flag that is also something that a number of states are weighing about, including even a more limited amount of time in these programs for when a family member passes away. And there's actually a proposal in Colorado right now. If anyone's interested, feel free to reach out. But a possible amendment has been introduced to our paid family and medical leave program that would provide additional time if a child is in the NICU. So, as Sarah touched on, we at A Better Balance have been working for years on modernizing and really ensuring that definitions of family are realistic and that they're as inclusive as possible. And it's an area where we've seen tremendous advances in even the last few years. Certainly, I've been doing this work for 14 years. It's been a massive change in paid sick time and paid family and medical leave in how we define family. And that includes covering extended relatives. And as you can see here, 7 states now of the state programs allow you to take paid family and medical leave to care for extended relatives and what's often called chosen family, or loved ones with whom the worker has a significant personal bond or a close association. And then just to build a little bit on what you heard in terms of the number of weeks, we also work with, states ideally seeking, based on the research, at least 12 weeks of leave for all covered purposes. That is where most coalitions start at a baseline. But you do, as you heard earlier, have states that allow combining family and medical leave above that amount. And most states allow some form of that, as you heard, and including the leave for prenatal or postnatal issues. There's a number of states, including coalitions working now, to provide additional leave for pregnancy and childbirth complications, recognizing that birthing parents need to recover and then also should have the same amount of bonding time beyond the recovery timeframe. And then, as you can see, and you heard this earlier, a number of states provide longer periods of time for medical leave. And then wanted to use Minnesota as an example of a state that provides a cumulative leave cap that's higher. So Minnesota says you may use up to 12 weeks in a year for medical leave. You may also use up to 12 weeks for family leave. And if you happen to have 2 different needs, let's say you welcome a new child and you're also caring for an aging parent with a serious illness, you can combine your leaves up to 20 weeks in Minnesota. So there are different approaches and different protections when it comes to duration. And we have a lot more information on this in the guides that I mentioned. And then, just wanted to share a little bit more. And I think some of you maybe heard me present on this in some other webinars about different ways to build towards this progress, recognizing that the political possibilities in a lot of states may limit work that, can be done on this issue, or how robust a policy that has a political pathway can be. And certainly, organizing, I think one thing, having worked on this for well over a decade, is all of the state laws took multiple years to pass, really laying a foundation for organizing, building a robust coalition with affected community members, including older adults, people with disabilities, new parents, healthcare providers, business champions, really laying that groundwork is important. And certainly raising public awareness in your state on the need and importance. We have seen a lot of progress on government leave, so public sector covering state employees and providing them with paid parental leave or paid family leave. We've seen a lot of progress in the South, and my colleagues in our Southern office have worked on the ground and with a number of state partners to expand those protections. And similarly, we're seeing progress on paid family and medical leave or paid parental leave for educators as another area to build progress while also providing new protections to more workers in your state. And then, other options to consider. A number of states have built power and laid the foundation for comprehensive leave by seeking funds, whether through a budget or in some cases, independently fundraising for actuarial studies to really dig in to the research that you just heard about and that Prenatal-to-3 can help at having some of the actuaries who states turn to really model what does a specific program look like, what will the costs be, and we've seen a number of states build by passing legislation to commission an actuarial study. And then it can cut both ways, but we have seen a lot of examples of successful high quality task forces that have studied the issue and issued recommendations to a state legislature on the topic, commissioned expert reports, in some cases actuarial studies as well, and that can be another way to build a foundation. And then on the public sector laws, we have a map, and that link will be included in the slides, of the growing number of states that have enacted paid family leave or parental leave. And you can see the diversity among the states geographically here. And one reason it is something that a lot of coalitions have taken on is that you also see women and BIPOC workers disproportionately represented in the public sector workforce and really impacted by these state employee leave efforts. We've also seen progress with local governments adopting these policies for their own employees. And then just to touch on examples from the South, we've seen progress and new protections in Georgia, Tennessee, South Carolina, and North Carolina on providing paid parental leave to educators. And then here finally are some examples of the actuarial studies and task forces. So, we've had task forces in Colorado, in Maine, both of which helped to pave the way for eventual programs that are now on the books. We've also seen Louisiana had a task force commission that studied the issue, made recommendations, and really helped to build the case. Similarly in New Mexico, where there's a very active campaign as we speak, and the New Mexico coalition has really drawn on strong recommendations from their state task force. And then a recent example in Michigan, the state did commission an actuarial study on a robust, comprehensive paid family and medical leave program. And the data that came back from the actuaries were really positive. It showed a program with very strong policy parameters, would be affordable, it'd be solvent, it'd be sustainable, and it really will help the Michigan coalition as they move forward. And then you do, of course, just want to think about the different considerations with these approaches. For example, if it's a task force, how the task force is designed and who is appointed to it can be critical to the outcome. You want appropriate parameters for an actuarial study that back up your state's efforts in this issue. And really do want to weigh the strategy with these approaches, and that's something that we're able to help with at a better balance. We also have model legislation commissioning an actuarial study, so definitely a resource if anyone's interested in pursuing that. And then, just to wrap up before I think it'll be opened up for questions, but We have a lot of resources, more than I could put on this slide here. But we have a lot of fact sheets on paid family and medical leave, the business case for it, implementation timelines, best practices. A lot of folks, if you haven't seen, one of our most utilized resources are our interactive comparison charts. And we have one of all the paid sick time laws in the country and one on all of the state paid family and medical leave laws. And you can actually create your own comparison. You could choose different laws, all of the laws, and choose different policy points and generate your own comparison chart. As I mentioned, we have a model statute. It's been the basis for all of the programs around the country, best practices for comprehensive programs, as well as state employee specific programs, and then the map that I mentioned of where state paid parental leave or paid family leave policies are in effect, and more information on each of those. And then my email is here, jmake@abetterbalance.org, and my colleague Fatima Hamid Byrne, who also is working around the country on this issue. So yeah, I will stop sharing my screen and turn it back to Raquel.
Thank you, Jared. Thank you. Thank you, Sarah and Jared, for painting such a great, robust picture for us and sharing so many nuggets from all your experience. Hopefully we won't repeat some of the mistakes, and we will have greater success in the work we're doing. And I know both of your organizations have amazing websites. So I know we put a lot of links in the chat, but I do encourage you guys just to go to the websites and look around, see what resources you're missing and what you want to look into, and go from there. So now I'm going to kick off the Q&A portion of our session. If you have a question, please raise your hand. We're going to try to get to as many questions as possible. We still have 15 minutes, but if we run out of time, we'll be sure to include responses in the follow-up email that we're going to send within the week with all the slides. All right, so let's see, lots of hands. I'm going to try to do this in a good order. Kelly, do you want to kick us off with a question? Get yourself off.
Yeah, sure. I'm looking at the link that you all sent through that is the Better Balance Model State Paid Family and Medical Leave Statute. And I'm just wondering, and I'm pretty sure that this depends on state to state, like what sort of, if there's any preemption or anything like that, or what is already in place. But I've had a question about what is categorized as a serious health condition. And the highlighted part of this model state policy says that it can either be defined at the Family Medical Leave Act or the State Family Medical Leave Act. Is there anything that will determine which of those determines where they choose what is a serious health condition overwhelmingly, or does that have to do state by state on which policy is being used for other determinations of, serious health conditions?
Yeah, thanks, Kelly. It's a great question. Most of the programs do follow generally the FMLA, the Federal Family and Medical Leave Act, which has a good definition of serious health condition. It's one that I think coalitions have been comfortable using. And then you also have the benefit of having more coordination that employers prefer between a state paid family and medical leave and those who are also covered by the FMLA. There are some states that have their own state version of the FMLA, some that predated the FMLA, some that expanded on it, in the 90s and early 2000s. So in some cases, states like citing to a state definition if it already exists, but generally, and it's something that we've helped and can help any folks with drafting or questions for your state. It generally follows the same kind of FMLA standard, if that's helpful.
Yeah, that's really helpful. Thank you.
And Leah, I see your hand up.
Thank you, Leah Sargent, Niskanen Center. I appreciated the little nod to Washington exploring supports to employers to help them cover the staffing gap. I'm just curious if you had any more details about that, or I'm really curious in state level survey data of employers on how they're bridging the gap while employees are out. And I was wondering if you had any more details on just what's happening on the employer side.
So happy to kick that off. And if you wanted to jump in, Sarah, I think Washington State's example is one that certainly has been of interest to other states. I think where you want to balance is, if a program has a lot of costs that go to employers, that will be a cost that's borne by businesses and workers across the state. So as you think about the various costs of a program, providing different reimbursement to employers is something that could raise the premiums for everybody. So I think it's always a question about how can we be most targeted to support business? And in some cases, it's more of a political negotiation, but also be sensitive to the fact that we want to keep premiums low for all employers and workers. But there is a lot of survey data. And so on a Better Balances website, we have a business fact sheet on our paid family and medical leave page that includes different surveys that have been done in states of employers that show a lot of strong support once a law is passed and implemented, including a lot of takeaways that state that employers, once a program is in place, use their savings from not paying an employee while they're on leave if they need, for example, to put costs towards overtime for somebody else or a temp employee. But the majority of businesses do report that they make it work. Different colleagues help out and you adjust within the workplace, and that is doable. But I think what's really helpful to remember is that under these state programs, if somebody is taking paid family and medical leave, they're collecting their wage replacement from the state fund, and the employer is not paying that person their wages while they're out. So that's savings that can be used to help cover the costs while the person's out, if they do exist. So yeah, I don't know, Sarah, anything you wanted to add, but that's some of what has been surveyed, and we have more of that on our business fact sheet on our website.
Yeah, no, that last bit, especially that you shared, Jared, was what I was going to add. I know too that thinking about grants, New Jersey has also provided different grants to help with outreach and education, both for families, or workers who might qualify, but also to kind of help employers navigate through a system potentially. But as you all said, I mean, there's survey data that kind of says that employers make it work and tend to really like it. We also have a fact sheet kind of on the business case and how states address this. So I'll throw that in the chat too, but yeah, thanks.
Great. Well, it looks like we also have a question in the chat from Jillian. I'd love to know more about any work being done to improve bonding leave uptake among fathers. Do you have any resources you can share on potential paternal leave incentive mechanisms that states can look into implementing?
Oh, I was gonna actually, Jared, I was gonna say to you, I know Colorado has done a really good job of kind of making sure that dads know, or their parents know that they have access to leave, and that this leave is job protected. And so they've seen higher take-up rates than some of our other states have done. And I think that has also bared itself out through other research, as I recall, that there's maybe earlier in the program, maybe less dads took leave, but as more awareness, sort of who qualifies for leave is made, more and more dads are taking leave. But certainly thanks for the question. But yeah, I'll send it to you, Jared, to talk about Colorado.
Yeah, Colorado, I mean, I think to answer the question, simply having a statewide program that provides benefits at a high enough level that workers can afford to take the leave and that it's job protected and it's gender neutral is the first big step. And to speak to Colorado, in the first 6 months of the program, more than 40% of all bonding claims were from male identified parents, which is huge. I mean, that is a massive change from leave taking patterns when there's not a paid family leave law. So Colorado is an example. I'll drop in the chat if folks are interested. The state in Colorado put out something at Father's Day about that. And so I do think, to Sarah's point, it's about public education, certainly in states that have protections, making sure that groups and advocates are getting the word out in the community that these are gender neutral programs, and that also the state itself, agencies have a real opportunity to work on this to make sure that dads know that they have protections as well. But I will say there's research that shows that the policy decisions are really important to fathers' leave taking. So having a high enough wage, replacement level, job protection, and enforcement, because unfortunately we see this firsthand at a Better Balance. There, and this site for us is, I think, anecdotal, but there are certain cultural stereotypes around fathers and taking leave that can lead to retaliation. And so making sure that there's also protections to ensure if an employer is violating the law, or communicating with a new father that he shouldn't take leave under one of these programs, that there are protections, will be really important to ensure that folks who are eligible feel comfortable taking the benefit.
Thank you. Okay. Erica Gonzalez has a question. My team and I at MDRC are trying to get a better understanding of awareness and barriers to states' paid leave programs. Would love to hear general thoughts on how to increase awareness of paid leave programs and how to make the process of applying to paid leave programs and FMLA easier.
Yeah, I think just to sort of start out with, Erica, I know we can definitely share some more resources with you via email, but one of the things that I know some states have done, honestly thinking about New Jersey again, with some of their grant programs, is they have specifically worked with community-based organizations. So organizations that are already working with folks that are trusted entities within communities to be the ones that make sure that they're messaging about that there's access to paid leave, and then, you know, being able to help folks apply for the program. I think there are certainly things on like an administrative level that you can do, that states can do to make sure the application is easy. And I know that there are best practices in that regard, and a lot of times the states, like we have found states that are currently administering the programs, like they want to create a community of practice for themselves, to share kind of what they have learned about how to make those applications easy to understand. 1 pages, 2 pages max, you know, kind of best practices like that are generally speaking good for reducing administrative burdens across state benefits programs. I don't know, Jared, if you have anything else to add. That's some of what first comes to mind for me.
Yeah, no, I agree with all of that. I think it's a really effective model to try to ensure that states partner with and re-grant to community-based groups to help with outreach and education. And then, of course, making sure that when these programs are passed and implemented, that the state agency has the funds to be able to do robust outreach and education. But really welcome, the more research around barriers and ways to overcome them, the better. But I do think, we're seeing more and more best practices of how states can make their application portals more accessible, more streamlined. In addition to writing Colorado's law, I was in a serious accident 3 days before it took effect. And so I was one of the first people to use it in a weird twist of timing. But I will say, was having worked on this for so long, really exciting to see, at least in Colorado, that the portal was very easy to navigate, very accessible. And so I do think states are thinking a lot about this, that are already, have programs in place and have good models that can be shared out. But definitely an area where the more research, the better.
Great. Well, we just have a few minutes left. I'm gonna close the questions, but I want to thank you all, the folks that asked questions, that leaned in, helped make our discussion fruitful. But before we close, I want to bring your attention to 2 quick things. First, as you strengthen, your paid family medical leave muscle, and it might be that you're just starting out, or maybe you're in real deep. Regardless, I want you to remember that the NCIT is really here to help you. You've got access to our no-cost campaign consultation program, as well as getting connected to experts such as the 2 on the call today. So We're here to help. We support advocacy campaigns by mobilizing communities, advancing science and research through communications and messaging expertise. We offer tools, resources, connections to partner organizations, one-to-one coaching, trainings for organizations. And we really just want you to know that each request starts with a conversation, and you don't have to have all the details ready. We're here to be a thought partner at the least, and please reach out. So we're going to put the link in the chat, and it's also on the slide, how to get in touch with us. And then the second thing I wanted to alert you to, so sorry, next slide, is a survey we're going to have. It's really important for us. It's really important for us to get results, to know how we can get your feedback and make things better. So take a few minutes. That's going to pop up on your screen. We do take your feedback seriously. So thank you so much for joining us today. Thank you so much to Sarah and Jared for your presentations, and for all of you asking questions. I know this is really hard work. And if things feel especially hard right now, don't forget that your work really matters. It's really critical to families in our country. And
You can't take the
we
poll.
appreciate you.
Oh,
And we'll be, sorry, what'd you say?
The poll's not available to us.
The poll's not available?
No, it's just the zeros are showing, but none of us can take it.
Oh, shoot. Okay. Well, I bet our tech support, Angie's working on
There
it.
you
Oh,
go.
there. Is that working this time?
It looks shitty.
Okay. Great. So it should be popping up, and hopefully it works this time. Like I said, we really take your feedback seriously and want to continue to improve the quality of our webinars. So thank you so much to everybody today. We're going to keep it open for another minute. You can fill out the poll, but if you need anything at all, please reach out, and thank you.